Kia ora koutou, ko Angela Ballantyne tōku ingoa, and I work at the University of Otago in Wellington, and it's a real delight to get to speak to you virtually for 20 minutes on the topic of unconscious bias. So today we're going to talk about what unconscious bias is, how it affects you and your sense of self, and the opportunities available to you and your interactions with your colleagues and your patients. And finally, we'll talk a little bit about strategies for addressing unconscious bias. What can we do about it? Now, spoiler alert, there's no easy fix. And if you look at the evidence base, suggests that sessions like this, for example, a 20-minute long session is likely to have very little independent impact on your unconscious bias. But we will talk about what strategies are available. So first of all, what is unconscious bias? Bias is really cognitive heuristics or patterns of thought, little shortcuts that we have. Sometimes we refer to them as schemas. Those are ways of organizing information and relationships between ideas. And essentially, it's sort of a mental filter that you have through which you see the world that helps you quickly navigate the world. So for example, if I say the word fire, you will already have a range of ideas and concepts that you link to that, that's in your mental bucket of fire. So that might be warmth, comfort, marshmallows, danger, heat, and those ideas are linked in your mind. Now, the reason that we have unconscious bias is because it allows us to really efficiently allocate our attentional resources. So the first sort of takeaway is that bias is an absolutely essential part of adult human functioning. You couldn't operate in the world if every environment that you entered into, you had to analyze consciously from first principles. So bias allows us really to focus in on key parts of the environment. So for example, when you're driving, you're not usually equally focused on every element of what's going on the road. You're not reading the number plates of every car that you pass. You tend to be focused on traffic lights, for example. When you learned to drive, that was a much more cognitively difficult process, and you needed all of your attentional resources focused on driving. You often couldn't have a conversation at the same time, for example, and it was really stressful. And certainly when we drive in a new city, country overseas with different road rules, we realize then how much attention we have to allocate to driving. Compare that to driving home late at night from a shift to your house on a route you know really well. Sometimes then you might not even remember the trip, right? You could do it almost all on in an automatic way. So bias is really useful because it helps us to focus in on very specific parts of the environment around us. And we can do a lot of the processing and the decision-making we need to do in our lives subconsciously or automatically. Unconscious bias forms through a type of pattern recognition or sort of a statistical model of how often certain things happen together. So if you're a parent, you'll know that children learn about gravity by throwing things all the time, right? Throw things off the high chair, throw things across the room. And so by the time they're a few years old, they have a really, and they're learning to walk, for example, they have a really intuitive sense of the physical world around them and of gravity. So we learn about the physical world that way through experiencing the world, but we also learn about the social world that way. So when my daughter looks out at the world and sees that 95% of world leaders are male and 95% of CEOs of Fortune 500 companies are male, and then goes to school and sees that all of the teachers are female, but the principal is male, she starts to associate the ideas of competence and authority and leadership with masculinity. And it's very hard to just sort of consciously tell someone to override that pattern recognition system. It's important to understand that bias is interpersonalized and shared. So often we can talk about, sexism as something that men do to women, or racism as something that white people do to Black people or people of color. And there's certainly truth to the extent that people who are in positions of privilege often have more control over those social patterns and hierarchies. But a really important element of bias is to understand that that this is a cultural phenomenon and it's a form of shared social language. And we can all participate in policing gender roles or race roles, for example. And the degree to which bias and stereotypes can be internalized is a really important and sort of pernicious way in which these stereotypes can be perpetuated over time. So there's something called stereotype threat, which is when you are aware of a stereotype, a negative stereotype that applies to a group to which you belong, that can actually undermine your performance. So for example, it could undermine your performance in a job interview or in an assessment at university. So some research, for example, has shown that stereotype threat can impact your ability to do maths. So if you do give students a math test and take that as the baseline data, and then you give the second group of students a demographic questionnaire, which asks female students to tick a box saying that they are female, that in and of itself is enough to initiate a stereotype threat that reminding female students of the stereotype that men are better at math than women, and that can actually undermine their performance. By comparison, if you ask Asian female students to fill in a demographic questionnaire indicating their ethnicity before they do the test, they are reminded of the stereotype that Asians are good at math, and that can actually improve their performance. Same thing happens even with groups we wouldn't think of as sort of being marginalized or disadvantaged. So if you take young, white, male athletic students at a university, and you tell them the reason you're assessing their performance is to compare them to Black athletic students, that actually undermines their performance. They run less fast, they run more slowly than if you hadn't told them that. So it's important to understand the degree to which unconscious bias can be internalized. So why is bias problematic? Bias, for the most part, is enormously useful and, as I said, sort of completely essential to how our minds operate and how we process information. And that's in part because a lot of the intuitive understanding we have of the world will be a good predictor for our future engagement. So gravity, for example, the fact that I have an intuitive understanding of gravity means I'm more likely to be able to catch something if I drop it. And that is going to serve me in good stead through the whole course of my life. Where bias is problematic is specifically in relation to areas where, as a result of conscious thought and reflection, we've decided that as a society, our historical ways of operating weren't acceptable and we want to change those. So ideas like Black Lives Matter, civil rights movements, Me Too, legalizing gay marriage are all areas where we're having a conscious debate about how we want our society to operate and how we want to allocate resources. In those areas, we might have consciously committed to equity goals, but the problem with bias is that it can sort of act like a historical ball and chains, constantly using outdated stereotypes that can inform our reasoning. So we all like to think that we are ethical, rational, objective, responsible decision makers. And the idea of bias can be really challenging because it suggests that we're not as rational in our decision making as we would like to think. Part of what's tricky about bias is that it's really hard to look at your stereotypes and your biases directly. We sort of have to look at them indirectly. So this is a really lovely example of that, I think. If I give you the phrase Black teens and hoodies or African-American teens and hoodies, your mind will already have a file that includes a range of ideas and concepts associated with that idea. And it probably will look nothing like this. And that little jolt of surprise when you see this image and realize that it's not something you've seen before, what that tells you is that the mental file in your head regarding Black teens doesn't naturally include concepts like joy, enthusiasm, innocence, playfulness, warmth, color, vibrancy. And that's really problematic, right? So I think this is just a nice example of letting you sort of see inside your own head for a minute. Part of the result of unconscious bias is that we actually perceive life through this mental filter. So we think we're looking out and seeing the world and seeing social interactions and judging people sort of on their merit, and we see reality for what it is. But the truth is we are seeing reality through a mental framework and mental architecture that is composed of our unconscious bias. So for example, you have that experience where you hear of a new singer or a new author, and suddenly that name is popping up in literature all the time. Or you find a new word and you learn the definition of it and you realize, again, you see it all the time. It's not that person or that word is appearing more frequently than it was before. It's simply that when you didn't recognize it or know what it meant, your mind was filtering that out. You weren't even seeing it as part of the piece of work that you were reading. So there's a study in Auckland a few years ago now that asked lawyers in Auckland, is there a trend for female lawyers to leave the workplace? And 95% of female lawyers who were interviewed said, yes, that's true. That's a real thing. And only 30% of male lawyers. So there you've got colleagues who are sitting in the same offices, kind of experiencing the same social dynamics in their workplace, but their perception of the reality of that workplace is completely different. And that's in part because we live an embodied experience of the world. So lots of research suggests that and demonstrates that the way people interact with us depends in part on assumptions they make based about our bodies. And that includes gender, height, race or ethnicity, weight, attractiveness, the clothes you wear. People are making very quick assumptions about you based on the body that you have. That changes how they interact with you. And as a result, that changes how you expect the world to treat you and becomes internalized in a certain way. And so, you know, we know from research, for example, that female medical students are much more likely to be assumed to be a nurse in the hospital. And that's simply an experience that male medical students don't have to anywhere near the same extent. So medical students are having the same medical education, but their experience of that workplace is very different. And so one takeaway from that is to have, you know, quite a bit of humility about extrapolating from your own experience of the world to assume how others experience that kind of same workplace, for example. And it's very rare that we can step outside our own bodies and see the world through a different lens. One example of someone who's done that is someone called Ben Bars. So Ben started out life as Barbara Bars and was professor of neurobiology at MIT and at Stanford. And he spoke a lot about his experience of being Barbara and being a woman in science before he transitioned to being Ben. And he was a huge advocate of gender equality in STEM in America. So sort of two quick anecdotes. One is he talked about the experience of when he became male, having people wait for him to finish a sentence before they started speaking. And he had never realized that when he was presenting as female, people constantly interrupted him. That was just normal, right? That was just the way people had conversations. And he only was really able to see that when he became male. Another example is him giving his first lecture as Ben and hearing colleagues walk out and say, wow, his work is so much better than his sister's. Now, what the work they were familiar with was his work when he was presenting as Barbara. So this gives you a real idea that it's, you know, we're not necessarily seeing the competence of the work or the originality of the work in and of itself. We're seeing that through a lens where work that is presented by a male speaker comes across as more competent and original. And that should lead us to be really wary of the ideas of objectivity and particularly meritocracy. So this is a lovely study they did at Yale University where they got students and asked them to pick between two candidates for the next police chief. One was Michael. He was streetwise, risk taker, lived alone, and had great relationships with his fellow officers. The other was Michelle. She was quite different background, well-educated, politically connected, media savvy, and had a spouse and child. Now, the first group of students, when given this scenario, unsurprisingly chose Michael. And the sort of the interesting part was the degree to which they had made that automatic decision, but then they were able to consciously come up with a whole lot of reasons and justifications for why that was a justified choice based on merit. Now, the second group of students, you switch the profiles and you have one applicant who is Michelle and one who's Michael, but now their profiles have been changed. So Michael is well-educated and politically connected and media savvy, and Michelle is streetwise, a risk taker, and lives alone. Now, the second group of students also chose Michael, but their reasons now were completely different. In this case, they thought that being well-educated was more important than being streetwise. This suggests that we don't really review candidates based on their merit alone. Part of what we're looking for is based on their body, who most closely matches our preconceived ideas of what a chief of police would look like. Now, a really interesting part of this study was they tried to predict which students would be most gender biased in their assessment. And what they found was that self-perceived objectivity was most predictive of gender bias. So students who agreed with these statements, my judgment in this study were based on a logical analysis of the facts, and my decision-making in this study was rational and objective, were the most biased. Now, why is that? It's because students who are convinced they're thinking rationally have very little incentive to slow down their thinking, look for counter evidence, try and interrogate their thinking, and use some strategies that I'll come to in a minute called slow thinking to try and reduce bias. The way this plays out in the workplace in terms of gender bias is one example is the pay gap. So men tend to choose high paying professions like doctor, engineer, CEO, while women naturally go towards lower paying careers like female doctor, female engineer, or female CEO. And if you look at data from the US, you can see that there are very male dominated areas of medicine and very female dominated areas. And that correlates very closely with areas that are thought to be harder, more difficult, high prestige, and high paying. So there's a really clear match between areas that are perceived as difficult and therefore high paying and that are male dominated. So you might think a solution here is to really actively recruit women into some fields like interventional radiology. This brings us to a really fascinating study done in the US that looked at employment data. So this was a big data analytics study from 1950 to 2000, so 50 years of employment data in the US. And it found that when women moved into occupations in large numbers, those jobs began paying less even after controlling for education, work experience, skills, race, and geography. So what's going on here is it's actually the presence of women in certain fields, which leads to the perception that their work is less valuable and less difficult because of outdated stereotypes around that link the ideas of masculinity with competence, originality, brilliance, and kind of intellectual difficulty. This suggests that if you moved more women into those high-paying medical specialties that were male-dominated, you might actually be more likely to see a decrease in the overall pay in those areas. So there's an enormous amount of literature that demonstrates bias in medicine and how these kind of different unconscious biases impact the opportunities for female staff, the care we provide to different patients. I'm not going to go through all of this. This is only a tiny snapshot of the literature that's available. Research, suggesting that female patients are more likely than male patients to have their reports of pain be perceived as emotional. White patients are more likely to receive pain assessment and appropriate pain medication than Hispanic or Black patients. Lyme disease is diagnosed later in non-white patients because a lot of the training material is done on what that kind of iconic rash looks like on white patients. We know from a lot of the debate around COVID, pulse oximeters are less accurate for non-white patients. I mean, the list just goes on. One study I will talk you through because it's quite interesting and quite subtle, looked at letters in support of applicants for transplant surgery and found that letters for male applicants were significantly more likely to contain agentic terms such as superb, intelligent, exceptional, and future leader. And letters for female applicants were more likely to use communal terms like compassionate, calm, and delightful. So what that study indicates is that even if you were going to do blind review of those referral letters, there are still really subtle social cues that we use to link the ideas of competence and masculinity, for example. So how does this sort of impact patients? So weight bias is a really interesting example of the circular way these stereotypes can be perpetuated. So for example, there's a lot of research suggesting that weight bias is really pernicious in medicine. This is a famous weight activist, Carissa, who says that finding a doctor who wants to treat me as a patient without prerequisite weight loss has been nearly impossible throughout my life. So weight bias in medicine is actually an independent cause of health disparities. And this is because people who experience weight bias, including from their doctors, can result in increased eating as a stress response, decreased self-regulation, increased cortisol, internalized shame, which leads to avoidance of exercise, increased risk of anxiety and mood disorders, inadequate healthcare. So doctors across the spectrum spend less time and develop less rapport with patients who are overweight and obese. leads to under and misdiagnosis, and that can lead to avoidance and delays in seeking healthcare. So you can see how these can be really cyclical in terms of the ongoing relationship between bias and behavior of patients and their access to healthcare. So really the kind of takeaway from this is it's so much about perception, right? We have distorted perceptions in relation to stereotypes about health and weight, about gender and competence, about race and non-compliance. And we are not seeing the world, and we are not seeing patients just as they are. We are seeing them through this mental lens, which can be distorting. There's not a lot of good evidence about how to address this. Some of the most effective research, this is by Daniel Kahneman, world-leading Nobel Prize winner in economics, suggests that we have two systems for analyzing how we make decisions. System one is fast, unconscious, automatic, and really useful for making everyday decisions, but can be error-prone. System two is slow, conscious, and requires effort, but it's much more reliable. So a good example here would be like a surgical checklist, right? Where you are implementing an organizational policy that is slow, conscious, and effortful to try and reduce errors. When we're making decisions about appointing people, for example, if we look at fit with the current clinical team, that's a very sort of intuitive, automatic system one assessment. When we do blind review, that's much more likely to be a system two assessment. At the organizational level, there is research that some of these strategies can be effective. So defining evaluation criteria in advance, that didn't happen in the Michael Michelle case. Doing blind review, collecting data rather than relying on our own subjective experience of the workplace. I'm a real fan of targets and quotas and affirmative action policies. For example, the University of Otago policy to actively recruit medical students who are Māori and Pacifica. And in part, that's because I'm so skeptical of the idea of meritocracy. I think there's really no unbiased way of appointing people to positions like, med school. And so we can either do it in a kind of active, conscious way that meets conscious equity goals we've committed to, or we can do it under the pretense of meritocracy, which means we're likely to perpetuate historical patterns. On a personal level, the takeaway is you can't, because unconscious bias is a system, a pattern recognition system, you can't just tell it to process things differently. If you want to see the world differently, you have to experience the world in a different way. And that can be a whole range of things. You can follow fat positivity, body positivity, content creators on Instagram. You could learn some te reo. You could follow the Women in Surgery Twitter feed to better understand the experience of women in surgery. You can prompt yourself to read literature that really centers the experience of people of color. You can experience different cultural events. You go to a drag show if that's kind of outside your world of experience, and go with a kind of open-minded view about seeing people in all their humanity and glory in a context that you might not be familiar with. You can listen to music and literature produced by people you wouldn't usually follow. So on a personal level, my takeaway is it's about damn time you started watching Lizzo's music videos. That's a really good kind of homework activity for you. Thank you so much for your attention, and I hope you found that useful.